All right, let's start. So welcome everyone, and thanks for joining in for today's session number 4. And we have covered so far 3 sessions. For those who are joining for the first time, I'll just quickly go through the topics that we went through. The session 1 was about more like history of lean and the mindset about lean thinking. What is lean? The session 2 was understanding the system thinking lean principles, and we did an exercise to understand the lean waste in healthcare environment. And the session 3, which was the last session, was on a very important topic, which is understanding the value stream mapping. So as one of the principle of lean thinking is map the value stream. Once you specify the value from the customer point of view, which is a patient in a healthcare environment, you need to map the value stream, and the tool that we use to map the value stream is the value stream mapping. So we have done this in the last session, session number 3 last week, understanding VSM value streaming exercise. We also did an exercise to understand how to create a value stream for a process in emergency department. So all 3 sessions have been recorded. So after this session today, I'll be sending an updated note in the WhatsApp group with all the links of previous sessions along with today's session as well. So today's session is also on a very important topic, and I'm not sure how many of you have used this concept before. This is called A3 thinking. So A3 thinking is a process, or it's not a process. I would say it's a methodology which was developed at Toyota. The intention of that methodology was to making problem solving process more logical and more simple. Just give me a moment. So usually what you might have noticed that whenever we talk about problem solving in any environment, we have so many tools to be used. Now in healthcare, you might have heard of we use PDCA. People say, let's use PDCA thinking. Some people say let's use DMAC. Some people say, let's use focus PDCA. Now what happened is that we get lost. We get lost is in the terminologies. Now, when we say PDCA, let's use PDCA for a person who is not well versed with the problem solving methodology, or who's not into, let's say, quality domain or improvement domain, and who doesn't have the skill set. He may not understand what does PDCA mean and what do I need to do. Even if he knows plan, do, check, act, which is very simple, or a define, measure, analyze, improve, control, DMAC. But the point is that for a person at a ground level, or the frontliners who are not experts in these methodologies, it does not mean anything to them. So it just turns out to be an exercise which is more like creating a report for the purpose of some certification body, for the purpose of some accreditation bodies. So it does not help us create a thinking of problem solving. Now, Toyota, as you know, I mean, as we have gone through previous sessions, their objective was to make things simple, make things easy for people to understand. And that is the reason they evolved this methodology, which is called A3 thinking. So we'll go through the concept of A3 thinking fundamentals, and we'll summarize it with the help of an exercise. And in the end, we'll take any feedback if there is any. So before again we jump on to the A3 part, let's again do a recap of why lean. So there are 3 aspects of why we need to use lean principles in healthcare environment or in any environment. First is quality, second is safety, third is efficiency. Lean helps us give more time with the patients. It reduces patient wait times. It helps us reduce errors. From safety point of view, it helps us standardize the workflows, reduce the unnecessary workload, duplicative work, and improving the handoffs. And we have seen this in the previous sessions. In terms of efficiency, it helps us do more either with the same resources or with the less resources. That means it increases productivity, and it also eliminates the overproduction. That means it helps us reduce the inventory. So this is a very beautiful quote from Toyota. And what this said is that at Toyota, we get brilliant results from average people managing a brilliant process. At Toyota, we get brilliant results from average people managing a brilliant process. And others get average results from brilliant people managing broken processes. And it's a very powerful quote that talks about sorry. So it's a powerful quote that talks about it's not about people driving results. Of course, I mean it comes down to people, but it's not people's mistake. It is about what process and system which drives the outcome. So as I usually say, nobody comes to the work with the intention of making mistakes. Mistakes do happen uh, when the process and systems allows people to make mistakes. So people are not the cause of the problems. The bad processes and systems are the cause of the problem. So that's about lean. So what is A3? I mean, to begin with, we all know A3 is 11-inch by 17-inch piece of paper that we use for printing purpose. But when it comes to the problem solving, and that we'll walk through slowly, A3 thinking is a problem solving approach, and it is built around PDCA. It is a concise summary of the problem and the solution. It is a way of structured thinking. It is a communication tool for workers to report problems and improvement suggestions to management. It is a way for management to structure and discipline the improvement process, and it can be used for any kind of problems. Now just imagine, instead of you as a leader or you as a presenter or you as a problem solver, instead of preparing 10-20 slides to justify something or to present it to the management that this is what the problem was and this is how we have resolved this problem, or this is how we are going to resolve the problem. And usually in corporate world, in organizations, people get lost in slides. Everyone is focusing on preparing presentation slides, and less work is done versus the time which is spent on preparing reports. And Toyota wanted to make it simple. They wanted to make it in such a way that whatever is the problem, it can be captured in a single piece of paper, and that problem can be described as a storytelling. So if anyone who would like to understand what is the problem, what is the background, what are we going to do based on what evidence and facts, he can get a grasp of the situation by looking at a single sheet of paper. So that is the reason this is also called A3 thinking, because all of the summary and the background and the facts and everything is captured on a single piece of paper instead of preparing multiple slides. Now, of course, A3 enables PDCA. So it is replacing PDCA, because plan, do, check, act, as you all might be aware of, is also called a Deming cycle, is a mother of all improvement cycles. So when we say plan, the plan means determine and agreeing to the problem with current conditions, goals for a process, and a needed change to achieve them with actions and sub goals. That's a plan part. When we do a do as per plan, do, check, act, it means give the changes of the new process a try. You implement a new process, and then you check whether the improvement has happened, not happened, whether the needle has moved or not moved. And then based on the outcome, you you adjust your actions. So it's an act. Incorporate the learning into the new process, standardize and stabilize. And then PDCA goes on like this. And A3 thinking actually enables PDCA. As I said in the beginning, when I say someone, all right, you need to do a project and you need to use a plan, do, check, act cycle. Now, at a very higher level, everybody understand what is PDCA. Maybe some people don't understand, but they may not be able to use it. What to do? This talks about what to do but it does not talk about how to do. The how to do part is always missing in any project process improvement. Plan, do, check, act captures the essence of the methodology and the thinking at a very higher level, but it does not tell you how to do it. Now, this is where A3 comes into picture, and it talks about, all right, so when we're talking about plan, this is what you do. This is what you do. When you say you need to do something as per PDCA, this is what you need to do. And we'll come to that template. I'm just setting the context that still the PDCA is the mother of all cycle, and A3 thinking is something which enables the implementation and adoption of PDCA. Now, before that, we need to understand one important concept, because the improvement is always about doing something, improving something. And when we say improvement, that means there's some problem, something which is not happening as expected. So in this case, we need to understand what a problem is. Let me mute someone. Okay, all right. So what is a problem? A problem is a gap. Something is happening, but it should not be happening that way. Or something used to happen in the past in a certain way, but it is not happening in the same way. So the gap is from the current standard, what is happening right now. And sometimes it is a caused gap. Basically, you had an original standard, a certain way of doing things. And now that certain way of doing things has deteriorated. Now it has changed. Now it has moved to some other stage. That means it's a cost gap. And you need to go back to the current standard that we used to do this in this way, and now we are not doing it. That means it's a cost gap. So you have a base, you have a benchmark, you have an original standard, which is well established, but now you're not no more following the standard, or the standard is not being followed. So in this type of situation, the gap is a cost gap, and the objective is to maintain the current standard. Basically, go to the stage what used to be as an ideal situation. The second kind of gap is, okay, so we are performing at this level, and this level is no more sufficient in terms of how our competitor is performing. So we need to raise the standard. So in this case, nothing is wrong. Everything is okay. You are not doing anything wrong. I mean, for example, I'll give you an example. Let's say historically your waiting time in OPD clinic used to be 15 minutes on an average, and which is absolutely fine. 15 minutes you say is what we want to sustain. Now it has gone up to say 25 minutes, and you say something is wrong. You need to go back to 15 minutes. So this is a classic example of a cost gap. But let's say you are at a 15 minutes and you say that the hospital in the neighborhood, they are serving the patient within 10 minutes or within 7 minutes. So in this case, what you want to do is, now you want to improve yourself. Now 15 minutes is no more sufficient. So you need to raise the bar, you need to raise the standard. So in this case, let's say you say, I want to improve patient's waiting time to 5 minutes now. So now from 15 minutes, you move to 5 minutes. Now, which is raise the standard. So now you're creating a gap. So there are two types of problems. I think this slide makes it very clear: a cost gap and a created gap. And then you improve, and then you keep on improving. You keep on going to the next standard. So there are two types of gaps, and whenever the problem will come, we'll think about what kind of problem we are trying to solve. All right. So moving on to, now there are certain steps to A3 thinking. The steps are, and as we'll go through it, these are very logical steps. The steps are made in such a way that usually what happens, when we discuss a problem and we have a tendency of jumping to a solution. So we all have expertise in certain areas, and we think that we know what the problem is. and the people keep suggesting and throwing solutions at the problem, and then we keep on trying those solutions and nothing comes out, which is a very common way of uh, failing in problem solving approach. And it happens very often. Jumping to a solution based on a judgment, based on a hunch feeling, based on what we know may not be the right way of approaching the problem. I'll give you an example. In one of the industry I used to work. So the engineers used to work on a drawing, and there was an increase in trend in error rates in the drawings. So we discussed with the engineering manager and director, and I say, can you tell us what is happening? And the director confidently said that recently we have very new engineers being hired into the company and who are not familiar with the process. And that is the reason that, there's an uptick in the trend of errors. But we have a very robust training plan in place, and very soon this error rate will go down. And he was very confident about it. And we started the problem. We started the process improvement project. We collected the data and we segregated the error rate by two set of people. One was the engineers who were experienced engineers working with more than 5 to 10 years in the organization, and another set of engineers who were newly hired to the company. Now, when we did analysis of the data, there was something very strange. What director was saying, that there's a new set of engineers who are making more errors because they're still not aware of the process or the domain. The trend was saying something otherwise. It was not those the new engineers who are making the errors. It was actually those experienced engineers whose error rate was very high. So my point of giving this example is that even if you're very confident about your domain, about your process, you are an expert, and I know, sometimes say that, I know everything, I don't need to go into it. It is a best practice to validate your assumptions with collection of data. And this is what A3 thinking enables. It stops you from jumping to a solution, but rather it gives you a step-by-step approach of solving a problem. So there's certain steps to A3 thinking. The first question is that who owns the problem? Right? Identify the responsible person or the team who's responsible or accountable for the problem. The second question is, what is the problem? Define the issue, symptoms, and its impact. The third is, what is the background? What is the context and relevance? What's being addressed and why? Why are you talking about it? Why it's a problem? Why I did not talk about it before? The fourth question we ask is, what are the current conditions? So you need to present the current condition with data and facts. The fifth is, what are the root cause? Analyze and identify the underlying cause of the problem. Then we comes to the sixth question, what specific improvements is needed? 7 is, what are the possible countermeasures? And 8 is, how will you choose the fix? What countermeasure you need to implement? Then it comes, what are the cost and benefits? What is the implementation plan? How will you know it's working? And then what problem may occur during implementation? And how will you ensure follow-up and continuous improvement? Now, these steps goes in a sequence. So the point is that you cannot directly, let's say you're on a question, what is the problem? You should not directly jump onto the question number 7, what are the possible countermeasures, which typically in the absence of a very good structured problem solving methodology happens. People often jump onto the solution part of it. So that's a thinking process behind. Now you might be thinking, we have been talking about A3 thinking, but how does it look like? What we are talking about? I mean, is it a template? Is it a report? So yes. So this, I was not showing the report right from beginning because I don't want you to think that it's about report. It's not about report. It's all about thinking. It's all about thinking. Now comes the part where actually you document your thinking, and this is done in an A3 report. So A3 report, I'll show you the template, and then I'll come back to this slide one more time. So this A3 report template, something looks like this. So it has a different sections, and this is on a single sheet of paper. The first section is a background. The second is a current condition. The third is the goal and targets. Fourth is the analysis part of it. Then it moves to the proposed countermeasures, then the planning part and the follow-up part. If you see, this is like a storytelling. You cannot jump on to the proposed countermeasures without completing step 1, 2, 3, 4. You cannot jump to step 3 without completing step 2. You cannot jump to step 2 without doing the step 1 appropriately. Now, it is not that you do it as a report, but you do it as a thinking. Every time you complete a section of this report, you complete the thinking part, you sit down with the cross-functional team, you validate your inputs, your findings, your facts. Once everyone is on board, you move to the next step. And it prevents you from shooting in the wrong direction. Sometimes the problem which is not properly defined, you no matter how much resources you put into that, if the problem is not properly defined, you will not be able to solve it. Now, this is what this A3 thinking approach prevents you from happening. Now, what is an A3 report? Now, since we know how does it look like, is a structured process for solving problems, is a structured process for gaining agreement, is a structured process for leading and mentoring people, asking the right questions, communicating effectively, sharing and learning. So as I said, A3 is not about preparing a report. It's not about preparing presentation slides. It's a structured process for solving problems, gaining agreement, mentoring people. It's a single-sided piece of paper to tell you a story about problem solving, strategy, status, action plan. In today's session, we'll talk about only problem solving A3. Usually we have different kind of A3s, and the A3s for strategy, A3s for status reviews, A3s for action plan. But today we are talking exclusively about problem solving A3. In the end, it's a visual communication tool that is simple, clear, concise, and to the point. And it's not about the form or format, it is about the thinking process. So wherever the organizations I have worked in, and usually what we do instead of going into a presentation slide decks about problem solving, instead of saying focus PDCA templates, having a DMAC templates, we encourages people to use A3 thinking template, because this is a very simple, effective way which has proven to be very effective in many organizations where I worked in the past as well. And it used to be the only platform when we talk about any problem solving. So if somebody is talking about a problem, so the management used to ask, can you show us your A3? No reports, nothing, no slides, no presentation, and just a single piece of paper. And the management will walk through the piece of paper and understand what is the context of the whole situation. Now, the important element of A3 is it is a team process. You cannot do it alone. As I said, it's not about preparing the report, it's about thinking. So it needs at least two roles as per the way Toyota has done it. The one person is called the owner and also known as the author of the A3 report. He leads the creation of A3 report. He frames the problem, gathers facts and proposes solutions. Another is a mentor or a coach or a responder. So he guides the thinking process. He provides feedback, challenges assumptions, and ensures alignment. For example, if I am myself as a master black belt, I'm leading the process improvement in any organization, and say the problem is about, say, improving the insurance rejection rate in OPD setting, somebody would be owning the problem and he will be preparing the A3 report and I will be challenging the assumption. So when the background section is done, so we both of us, as an owner of the A3, the team and the mentor will go through the background together and will ask questions. How about this? How about that? Do we have the data? What does the trend says? And we'll challenge assumptions, we challenge the data, and we challenge the facts. Now, it cannot be done with a single person. As I think you understand now, it needs at least two roles. One is someone who's writing the report, who's leading the thinking process, and there's someone who is acting as a coach, who's challenging the assumption so that we don't do it wrong. So this is now when we go into the A3, what does the sections mean? And after the end of this session, of course, I'll be sharing all of this content with all of you. And you know that the drill is that I do not want to just share and throw content on everybody in the group, even the people who have not joined the sessions. And I'm thanks to you that you all are part of this session. So I'll be sharing a quiz, maybe tomorrow, that will check your understanding of A3 thinking of the session that we're going through today. And once you cross the 80% passing marks, you will get a link to download all the resources, including this Excel. At the same time, I'll be adding a couple of books for you and the presentation slide deck as well. That will give you a very good overview of A3 thinking process. So all the resources are absolutely, I'm happy to share with all of you. Of course, the only condition is that we all are learning. So there will be a template. You will very slowly, very soon will go through it, and that template will be available to you as well. Now, this A3 problem solving template looks like you have a title at the top. What are you talking about? You have a box, which is a background, where actually you need to justify why are you talking about it? Why are you talking about this problem and why now? What is the issue? The second block is current conditions. Where do things stand today? And you need to show it visually using charts, using graphs, make it more visual so that anybody looking at this A3 can understand and grasp the situation in no time. Then you set the goals and targets, what you want to achieve, what specific outcomes are required. And the fourth is then you do the analysis. In analysis, you can use any tool. You may use very simple tool like 5-way analysis. You can use Ishikawa analysis, cause and effect analysis, or you can use any complicated tool, whatever is in your toolkit is even statistical. After the analysis phase, now you understand the story, you understand what is happening, you understand the root cause of the problem. Then you propose countermeasures that in order to solve this current condition, this background, in order to achieve these goals and targets. And based on the analysis, this is the your current proposed countermeasures. Now, of course, as you know, all of you, you need to implement the proposed countermeasures. So you will come up with a plan, what actions needs to be taken, who will take what actions, what are the timelines, and so on and so forth. And you implement the actions. Usually, I recommend that any project that you do should not last more than 6 to 8 weeks. 6 to 8 weeks should be your timeline for completing any process improvement project. Now, once you do the plan part, you implement the activities, you keep on looking at the results. And if the needle is moving, that means your actions are effective. If the needle is not moving, that means your actions are missing the root cause of the problem, and you keep on changing it. The point is that, let's say at the time of analysis, you figure out something is not right, and you're not able to get to the root cause of the problem. So it gives you a chance to go back and validate your current conditions. Maybe your current conditions that you captured are not factually right. Maybe the background itself is not right. So at any stage of the step, if you see something is not right, maybe when you propose countermeasure, you plan and the needle does not move, maybe you did not stated the problem correctly. Maybe the goals are not realistic. So this whole approach gives you a chance of going back to and fro, and instead of jumping to something which is unknown to you. So this is how, in a nutshell, very high level, the template looks like. We'll come to this later on. Now I want to show you the Excel thing, what we use as a A3 problem solving template. I'll be sharing this with you. Now, I would encourage, why are you using so many presentation slides? Why are you using slide deck to present problems? This can be your single single source of all the information that we need to capture in any process improvement project, any problem. This is an Excel-based template. Like as you can see, once this template is filled, everything is captured here from background of the situation, current condition of the situation, target condition, analysis part, proposed countermeasures, action plan, follow-up issues. And this becomes your presentation. This becomes your storytelling. This becomes your learning database. This becomes your agenda to walk through the problem solving process. And this we have many of the organizations don't use presentation slides, or even if the presentation slides are also used, sometime it is only based on 6 slides. The first slide is background, second is current condition, third is target condition, fourth analysis, 5 proposed countermeasure, 6 action plan, and 7 is follow up. So even in the organizations, if you want to use presentation slide, as I said, it's not about template, it is about the thinking. Even if you very keen on using the PowerPoint, I would recommend that use this thinking approach, and just any project, any process improvement activities has to have only 7 sections, and these are the sections. These you cannot jump onto any section without completing the previous sections. So what does each section mean now? Let me quickly walk through it. So let's talk about the background section. So let's start from the top. The first is what is the title of your E3, what change or improvements you're talking about. And it talks about, let's say the title of the E3 is improving the patient satisfaction score, targeting the insurance rejection rate. Let's say this is the title of a problem. This is the problem you're trying to solve. The focus area is, let's say, OPD insurance / patient experience. Okay, let's say this is how you start, right? And then you talk about the background of the problem. In the background, what do you capture is you capture what are you talking about and why, what is the purpose, the business reason for choosing this issue, what specific performance measures needs to be improved, what is the strategic, operational, historical, or organizational context of the situation. So you make yourself clear, why are you even talking about this problem? What is the background? You need to be on the same page. You need to be something aligned with the organization. So you make sure that you have a very strong case. This, I would say, is a business case to proceed further. These 2 sections, background, current condition, is more like a business case that we need to tackle this problem, and this problem is very important to deal with right now. So when you come to the second part of this problem solving, which is a current condition, and you ask the following questions and you capture these questions in this part. Where do things stand now? What is the problem or need? The gap in performance, as we saw before. What is happening now versus what you want or needs to be happening? You ask question, have you visited the process, so that you're not jumping onto something and you say you're expert in something. And what facts or data indicate there is a problem? What specific conditions indicate that you have a problem? Where and how much you quantify it? Can you break down the problem into smaller pieces? And usually in this part we show facts and processes using charts and graphs and maps, etc. The next section is a target condition. Now you have a very clear understanding of background and current condition. Then you talk about target condition, which is what specific improvements do you need to achieve? Show visually how much, by when, with what impact, and do not state a countermeasure as a goal. Then you do analysis. Why does the problem or need exist? What do the specifics of the issues in work process, and so on and so forth. So as you see, I'll be sharing this template with all of you. So for each of the box, you have a checklist. that helps you complete the box. Not, I would say, not the box. It's the intention is not to complete the box. The intention is to complete the thinking part of this. So when you say you need to capture the current conditions, what are the questions you need to ask? So there's a checklist, there's a instructions how to do this, and then you move to propose countermeasures. Then you have an action plan where you capture all the actions plan. You have follow up and everything. If you look at what we have gone through, so there is a thinking which is on the left side of this slide, and the right side there is a report. So report and thinking goes together with each other. When you say the thinking is what is the purpose? Why are we doing it? I mean, why do we need to solve this problem? So basically this thinking is captured in the background part of the problem. When we ask question, what is the problem or need? And this is getting captured in the current conditions and the goal of the A3 thinking report. When we ask the question, what is the cause? It is captured in analysis part. When we say what is the plan, it is captured in countermeasure plan. And then we say what is the proof that based on the implementation of something that the needle has moved, something has improved. This is captured in the follow-up section of the report. So this, I was looking at some of the content, and I'll be sharing this with all of you. There is one coaching guide by Tracy Richardson. She probably worked with Toyota for so many years, and she has prepared a coaching guide driving the A3. How to drive the A3. Just hold on, let me. I hope you can see this. Can you confirm? If you can see what it's different from the Excel. It says coaching 1 to 4 steps guidelines. Perfect. You can see it. So it is a very good coaching guide by Tracy Richardson. So, and it walks you through step by step what you need to do to complete the A3 thinking and to complete the A3 report. So clarify the problem, break down the problem, target setting, root cause analysis, and it also tells you in detail what areas for coaching we can use in these different areas. As I said, it's not just about creating report. It's not just about problem solving. When somebody is acting as a mentor, maybe you as a senior leaders or you as guiding someone, so you can ask these questions as a coaching, right? So you can ask this question, does this section, when we talk about target, is the target quantifiable, achievable? So it again starts a thinking process. Does it have a how much and by when? If you say that we want to improve the OPD rejection rate, now the target is not clear. The target is not clear because it does not tell how much you want to improve, by when you want to improve. Let's say you say that we want to improve the OPD insurance rejection rate by 50% by the end of Q4. Now it makes it more specific. So in each section of the A3 thinking, these are the questions that you can use to coach and mentor people. And I'll be sharing this with all of you as well after the session. And there's one more thing I'll be sharing. This is again a very good guide prepared by Tracy Richardson. It talks about for each of the phase, purpose and problem situation questions. For example, when you're talking about the problem part, how did you identify the problem? How do you know is it visible? Why are you solving this problem? What is currently happening? What is the gap between those? Now this is a very good and robust guide, so that you just don't create A3 for the sake of A3. As I said, it's not about report. It's about thinking. So these two documents, when I'll share it with you, it will help you drive this A3 in a very structured, logical way. And once you do couple of A3s in this way, you will become an expert in driving A3s. So it needs couple of A3s to be done by yourself hands-on. And once you do it hands-on, you would know that what we need to do in different sections of the A3, how to approach a problem in the right way, what are the right questions to ask, what is the right information to capture. You will get a very good insight about it. Now, a good A3 is something which contains objective facts and data. The second is that a good A3 is something which tells a story. If somebody is reading from the top left part of the A3 and going to the bottom left part, and then coming to the right top part and going to the right top right bottom part, so it should tell a story. It should connect right from background to the current condition, to target, to analysis, to countermeasures, to action plan, to follow up. It should tell a story. If you give this A3 to any management, any leadership, or let's say you ask someone to explain the problem solving, you should be able to grasp the whole thing within 1 to 2 minutes. That should be the A3 should be such clear and neat and clean and concise. Now, let's say I was just creating an example, did not complete all the sections. Let's say we have a problem in OPD insurance rejections in OPD area, and our title is to reduce the OPD insurance rejections. So how will you write the background? I just wrote an example, and you can tell me, I mean, whether is it lacking something? Is it clear, not clear? How much detail it includes? The outpatient department handles around 300 patient visits daily. For the past 2 years, the insurance claim rejection rate was stable at 5%, which is within standard industry standards. However, since January 2025, the rejection rate has increased sharply, reaching 18% by May, a 260% rise. This has caused monthly revenue losses of $50,000 to $70,000 and added pressure on billing and registration teams. Staff now spend more time fixing rejected claims, and patient complaints about billing issues have gone up. Reducing the rejection rate is essential to keep operations smooth, finances stable, and patient satisfied. Now, I want you to speak. Does it capture the essence of the problem? The background. Can you tell what is missing in this background? Even though I wrote it, I can still see something is missing. What is missing? Can you tell? Please speak up. You can unmute yourself. Can you guess something is not right? Something is not making sense. Let's say I'm the writer of this A3, but you are the mentor, you are the coach. What question you will ask me if you read this background? Okay, the reason behind the problem. No, because we will not jump onto the solution. The reason behind the problem is something we need to investigate. So that will come down at around analysis part. Okay, so we'll not jump onto the solution because this is still the background. We are setting the context. So no, that's not the thing. The number of patient visits. Yes, please speak.
I think the time frame, and we need to make the target or the time frame when we want to reach the improvement that we need.
Okay, so as I said, we'll not jump onto this part until we finish this part, background. Okay, so we're not jumping into the target. We'll come to the target, but we need to understand what is wrong in this background. Something is missing. As I said, it is all about data and facts. And I'll tell you, staff now spend more time. What does more time mean? Correct? Very vague. What is more time fixing rejected claim? So I need to be very specific. What does more time mean? It's very vague. That is one thing. And patient complaints about billing issues have gone up. What does gone up mean? Correct? Does it make sense? So you need to be very specific about What does this mean? So that is, whenever you write any background, as I said, it is all about data and fact based. You should avoid keywords. I'll write the keywords that you should avoid: more, less, high, low. You need to quantify each one of them. So if somebody is preparing this case and you are reviewing this case, you should be able to ask, when somebody says staff now spends more time, you should ask question, what does more mean? Can you tell us, and how have you come to this conclusion that they spends more time? So there has to be some facts behind it. When somebody says that patient complaints have gone up, what does it mean by gone up? And how have you come to this conclusion the patient has gone up? Let's say now I say, all right, what I mean is that patient experience score for insurance have dropped from 90% to 70%. Now this captures the essence of this statement. Have gone up does not mean anything. But when you say that patient experience score for insurance have dropped from 90% to 70%, now this validate this statement with the help of effects. Now you can say that here in this case, in May, insurance staff spend 60 hours of overtime compared to 10 hours previous month. Now this justifies the statement that staff now spends more time fixing rejected claims. So you are not going to accept anything which is not validated with facts and data. Now, when we talk about this background, this makes this story very compelling, and it tells the need to do a project. Now, second thing is current condition. We need to quantify it. So what I did was I did create some data. So what you will do usually, sometime you need to make it visual, and let's say perfect. So if you tell it to someone that this is your current condition, is it not something very visual? Can you not see the rejection rate has gone up from 5%, 13, 15, 18%? Now it makes things very clear. What else you can capture? Let's say I also captured, because we have a system that helps us do this. So let's say okay. So this is also coming from the system, and you know the rejection reasons. So now anybody can, who's going through your project, can understand how things stand. So this becomes your background, which is validated by data and facts. And then it becomes your current condition, and you can add more current condition. So as I said, this is not about template, and I'm repeating it again and again. This is not about template at all. It is all about thinking. If you want to add more columns here, more rows here, because the data is not fitting in, add it. It does not mean that you need to contain this within the A3 paper size. It's more about A3 thinking. The printing you can figure out, that's not a problem. The point is that it is about A3 thinking. So if you want to add more space, feel free to add, because you want to add more data. It's not a writing on a stone that you cannot change the template. Let's say later on you say that no, I want to add one more box before current condition that says something else, as per your organization. Maybe you have organization values and you want to map this problem with the value in your organization. You want to add one more box, how this problem relates with the organization values, and you want to do it. So feel free to add. So you can customize this template, keep on adding the box if you want to add. But the point is that it has to follow a thinking. So you do a background, you capture the current condition, and I've already filled it, and you make your target conditions very, very, very specific. So let's say reduce the overall APD OPD insurance rejection rate to below 8% within next 3 months. Reduce rejection appeals and resubmission time by 50%. Improve claim submission rate to 95%. Now, can you tell me what is missing in this target condition? There's something missing here. What is missing here? I want you to speak. Something is wrong. I'm waiting for an answer. What do you think something is missing in the target condition?
I think the missing is the baseline, because we reduced the rate to 8, but what was the baseline?
The baseline is 5%. The baseline is 5% as we captured in in this current condition. What else is missing? Something else is missing. So what is missing is the timeline here. We did mention the timeline for the first target, but we did not mention the timeline in the second target. We did not even mention the timeline here as well. Okay. So we need to challenge each and every aspect. Let's say now we're very much clear about target condition. Let's say you have done analysis. I filled the analysis by myself, that why are eligibility coverage rejections high? Because of, say, lack of consistent real-time eligibility verification. Why are pre-authorization issues prevalent? Because of unclear workflow, communication gaps, complexity of insurer specific rules. Why are coding errors? Because of insufficient training for clinicians, lack of clinical documentation. Why is documentation incomplete? Because no standard checklist. Now, let's say you have done analysis and you have done analysis of why are we having this drop in the approval rate, and these are the reasons. Now, the next phase is, once you do the analysis, you thoroughly go through the analysis, then you propose the countermeasures. The proposed countermeasures could be implement automated real-time eligibility verification, standardize pre-authorization workflow, establish a daily claim scrubbing process, create service-specific documentation checklist, develop and conduct comprehensive staff training. Okay, so because this is coming from, usually what will happen, and you can all verify to this, when you talk about this, people usually jump onto this part, isn't it? People immediately start giving solutions, and most of the solution would be about conducting trainings. And it says that people are not trained, people are not following the process. People directly jump onto the solution. This is what A3 thinking prevents us from doing. We should not directly jumping onto the proposed countermeasure. Rather, we should be validating each and everything, making up a story, coming to background, doing a current condition, doing a target condition, doing analysis, then proposing the countermeasures. Now, in order to implement these countermeasures, you will have deliverable. I'll just put one deliverable so that you will understand. Let's say one of the proposed countermeasure is develop comprehensive training, staff training, and action could be training for admin staff, training for insurance staff, training for physicians, let's say. And who's responsible? Let's say the person who's responsible for physician, admin staff is, let's say, insurance team, because they are going to create this and they will train everyone. So now to implement all of these countermeasures, you will have a detailed action plan that will talk about the deliverable, action, responsible person, and the month when the respective action will take place. Let's say this is supposed to happen here, this is supposed to happen here, and this is supposed to happen here. And then you will have a detailed action plan. And after that, you will keep on measuring the same chart to see whether it has gone down or not. Let's say after May, you have June and you have July. In June, you have implemented few of the actions, not all. And let's say it has gone down to 15%. It has gone down to 15%. Okay. That means your action is now effective. Basically, you have improved. Let's say, I'm assuming, again, you continued with your actions. And now what happened? You have again measuring and you see that there's an again increased rate. So what will you do now? Because this is a follow-up phase. So what will you do now? As per PDCA, which phase you will activate now as per PDCA? When you see this happening, what is the phase of PDCA you will activate now? Which phase of PDCA? Not check. Now you will act. Because now you have seen, not plan. Plan is the left side. Planning is done. Planning is all this left side. Until analysis is all planning. Do is action plan. Check is what we are doing right now. Whether after implementing something has moved or not. First month it dropped down. The second month it again went up. So now we need to check and act. Check is done, act. What are we going to do differently? Maybe what happened was that after we have implemented the training, the reason could be the workflow has changed. Maybe there's some change in the process in the system. That means the process that we have trained staff on is no more valid. So we need to now act. We need to update our training plan and we need to retrain all the people. So because now we have seen it started decreasing, but in July it again went up. So that is the reason you do this whole cycle and you keep this one document dynamic and alive. It is not a static document, but once the improvement is achieved, let's say you have been able to achieve August, September. Again, you did the change. In August, it went down to say 10%. And in September, it went down to say 6%. And this is where you say, all right. So a project is closed because this is what you wanted to achieve. And then you will have a standard work to sustain the improvement. But as you can see, instead of going through multiple slides, multiple presentation slides, sorry, what is the question? Let me go back. There's one question is, just hold on. The question is, when I go back to planning, as there is a chance it was wrong. Oh, absolutely right. Absolutely right. I'm not negating this fact, of course. If you see that maybe that nothing has changed, maybe there's nothing wrong in the system, the process is same, still it has gone up. Maybe you need to go back to the planning part. Maybe something is done wrong on the left side. Of course, absolutely, I agree with you, but you don't directly jump onto the previous phase. So basically, when something goes wrong here, you go back to the previous step, and if you could not find anything is wrong there, you go to the previous step, and if you don't find anything wrong there, then you take one more step back. The way you have come forward one step at a time, you also go backward one step at a time. So absolutely right. I agree with you. Eventually, you may go back to the planning stage, because if there's nothing wrong with the action, there's nothing wrong with analysis. Maybe something is wrong in the background, or maybe in the current condition, the way we have captured it. So now I'll conclude this. And I would encourage you to go and search A3 thinking on Google. And you may search for A3 thinking reports in healthcare, non-healthcare, wherever your area is. And you would find that this makes whole problem solving very easy, very intuitive, very logical, very structured, and very visual. You don't need to rely on project reports, multiple presentation slides that people spend hours and hours working on and doesn't result in anything. Now, if somebody is looking at this, all you, let's say as a senior leader, you want to see is that, okay, I understand what is the current condition. I do not need to know all of this. I want to know whether this needle is moving or not. Now, if this is not moving, I don't care about all of this. So I will tell, can you please go back and do something so that we reduce the rejection rate? So this is how this makes the whole problem solving process very structured, very easy, and like a storytelling, going from top left to the right bottom. And usually A3 thinking is not something you can learn in one day, but I wanted to give an idea of this concept. I will share all of these resources with you. I will share other resources and books with all of you. A lot of content is already available online. If you want to ask me any questions about it, feel free to ask. And again, I want to thank all of you for attending these sessions back to back, many of you. And we have many good sessions to come in the future, inshallah. So I'll stop my session here. I'll be staying for another 5 minutes. If you have any questions, please, I'm here. You can ask me. Thank you. Thank you, everyone.